Hi, have you ever had pain while bending over to shave your legs, or maybe when you're holding something up overhead and twisting behind you or trying to get out of bed? Anyway, around it, you're in the right place. Because today I'm going to talk about four simple exercises that can help you to manage back pain, whether it's acute, subacute, or chronic, and even help to prevent injuries during your workouts. And the best part, these exercises aren't just for your back, they also benefit your hips, your knees, and your whole body. So stick around because what I'm going to show you just might change how you approach your pain and your mindset about your recovery. I'm going to start by asking, what if your injury could actually be the stepping stone to something bigger? I know it's hard to imagine when you're in pain, but I've been there. After my own ACL injury, I discovered that setbacks actually can help propel us forward. Well, but back pain is not a given after you've had an ACL injury. It can actually happen because things aren't moving right. Years after I've had my ACL injury, I can recognize when my quads are getting tight, the front of my thighs are getting tight, and I need to stretch them. If I don't do it at the right time, sometimes my back goes and gets a little wonky, and that pulls my pelvis into a position that it doesn't like, and it creates more pain. And you have pain when you're trying to get up from lying down, or yeah, I had pain, trying to roll over in bed. And really working on these breathing exercises helped me to realize how much the core will help to stabilize as you're turning and moving and changing position. So try to use as you learn these exercises, start to incorporate them into your day so that you can use your breath to stabilize your core, and it will decrease tension so that it braces a little bit, that it doesn't hurt as much as you start to move. Back pain, hip pain, knee pain can feel very overwhelming, but they don't have to define you. Let's shift our focus onto what's possible. Instead of saying, this is the worst thing that's ever happened to me, what if this pain led you to a stronger, healthier version of yourself? You may ask, why breathing exercises? Why are we talking about breathing? Because, you breathe every day. That's what a lot of clients say to me. Why do I need to work on breathing? I have to breathe all the time. And you're absolutely right. We do have to breathe every day. And our brain is hardwired to tell us, take a breath in and breathe out. That doesn't actually mean that we're breathing efficiently. Most of the time when we're in pain, we tend to hold our breath. We get all tense. We stop exhaling. We take a breath in and race for that pain to hurt. And that actually makes everything else tighten up. Also, breathing is a way of stabilizing your core. The diaphragm is the top part of the core, and the pelvic floor is the bottom part. In between, you have your abdominals and your lower back muscles that move in and out. When we have poor breathing mechanics, this will lead to increased tension and pain, especially in your lower back. When we start to breathe well, we can engage our core and improve the connection between your hips, your back, and your knees. So these four exercises are not just about breathing, they're about resetting your entire system. Let's talk about pain. There are three main stages of pain: acute pain, subacute pain, and chronic pain. Acute pain is when you're having pain within that first 2 weeks. It's pretty sharp, it's immediate, it kind of grabs. It just happened recently, and it's really limiting what you're doing. This, you might think, I don't want to move at all. I'm going to just lay still and not do anything. But here's where gentle movement is key. When we start to work on some of these breathing exercises, they're safe to do at any stage. If you can't touch your toes, you may try doing the crocodile. If you can't lean backwards, you may try the 90-90 breathing. And if both of them hurt, then you might just lie on your back and do some quiet breathing to allow your ribs to expand and take that long, slow exhale to allow your core to engage. Creating movement in the beginning in this acute phase that is pain-free and gentle, even if it's very small, will really help to get the blood flow going and help to reduce that pain. Subacute pain is when the healing phase starts. We can start introducing a little bit more exercise. That's anywhere from like 2 to 6 weeks and maybe even to 3 months. We can start doing some gradual movement. You start from the ground up you build your baseline, you start to learn how to move, making sure that you are breathing properly, that you're getting that good, firm exhalation to stabilize. And then you are able to progress and carry that over into things like sit to stands and bridges and all those other basic exercises that we start to do to improve our core. When we get into chronic pain, this is pain that's been there for a long time. Pain that you've had, it doesn't usually stop and grab you, but it's pretty nagging and it's been there and you just want to break that cycle. This, we want to focus on consistency, and we really need to start to progress the strengthening. Using these breathing exercises can help you as a warm up to help build up onto your squats, your deadlifts, all of which are really important on strengthening your back to help you prevent that pain in the long run and to allow you to be strong enough to feel like you can move again without having pain. You can also use these exercises as a warm up in any capacity if you don't have back pain. These are great to help get you started. You know, when you've had a stressful day and you're getting to the gym and you need to kind of get your mind right, run through these 4 breathing exercises as the start of your warm up. They're a great part of the dynamic warm up. You work through them, and then you get into things like inchworms and crawling and more advanced stability exercises, and that will help get you ready to do the exercise that you're about to do. So are you ready to dive into these exercises? These are the 4 main exercises that I think are important for every person with back pain, and they're crucial if you're going to work out at all. The first one is a 90-90 breathing position. For this, you're going to have your feet up on a ball, a couch, a chair, an ottoman. You're going to allow your ribs to be neutral, that you're not arching your back. You want your pelvis level. You want your knees slightly out to the side, about 45 degrees, and you want your legs relaxed. Engaged, relaxed, not just flopping all over the place. We want our chin tucked and the back of the neck long so that we're not arching our neck and our back. We're going to start just by breathing in and out. See where you're at today. When you check in, do your ribs expand out laterally as you breathe in, which will make your belly rise? And then do they fall? Do they contract? Do the ribs go in as you exhale? That's when the diaphragm goes up. So as we breathe in, the belly and the ribs are going to go out and expand like an inner tube around your body. And as you breathe out, your belly and the ribs are going to go in and get the engagement of those core muscles. We're going to try and breathe in for a count of 3 seconds, pause for 1, and breathe out for 6 seconds or longer. The better you get at this, the longer you should be able to breathe out. You're really going to feel your core fire as you exhale. So don't skimp on the exhale. The other goal is not to be getting into your chest. We want to try and limit what's happening up at our upper chest. So really focus on that lower rib cage and less on the upper rib cage. It's hard to do when you start, but if you work at it over time, it's going to get easier. The second exercise that we're going to work on is crocodile breathing. For this one, you're going to flip over on your belly and you're going to have your hands underneath your forehead and keep your shoulders relaxed. Your chin is slightly tucked. The ribs are down. The pelvis is level. You should feel pretty equal side to side on your hips. You'll have your hands underneath your forehead. You're going to feel your ribs expand out to the side as you inhale, and then they're going to fall as you exhale. Again, working on that lower rib expansion, trying not to get your upper ribs to move and expand as you breathe in and out. The benefits of this exercise, especially in the crocodile position, it can help to really quiet the nervous system while you're activating your core. So if you've had a stressful day or you're just feeling a lot of tension in your back because of whatever's going on, work on crocodile breathing, put that into your daily routine and see if you can just let things quiet down. The longer you work that exhale, the better that's going to be. And it reduces that tension in those muscles to help move things efficiently. Our next exercise that we're going to move into is a prone prop exercise. For this, you're going to come up onto your elbows with your hands and your arms in a triangle. You're going to try and keep the shoulders out of your ears. Again, the chin tucked, neck long. If your hands are forming a triangle, you're going to look right between that triangle. As you breathe in, you're going to feel your ribs expand outward. And as you breathe out, they're going to go in. Now, this is going to cause a little bit more compression through the lower back. Good compression, not bad compression. It makes those back muscles start to work. We are engaging those core muscles. This prone prop position is one that babies do right in the beginning as they start to move. And the more we develop that posterior core strength, the stronger we're going to be as we move on into higher level positions. So really focus on getting a long, slow exhale. It's going to help to improve your posture and it'll increase your lower back mobility. And our fourth exercise is a cat-cow exercise. And this is cat-cow 2.0 as per the Immaculate Dissection program, core program. And this, we're actually going to start moving with our breathing. So the other exercises, you'll notice you're kind of just holding in position, building stability, building those holding postures. This one, we're going to create movement with the breath. So you're going to start on all fours with your hands directly underneath your shoulders and your knees directly underneath your hips. You're going to keep your chin tucked, the back of the neck long. For this 2.0 exercise, we're going to keep your eyes looking between your hands. And we're going to start with your bottom sticking up in the air in an arched position. As you inhale, you're going to tuck your bottom under, rounding your back, allowing the hips to tuck under. That's going to be your breath in. That will put your lower back on stretch, but shorten your diaphragm. And then as you exhale, you're going to arch your back and try to shorten the lower back muscles and lengthen the diaphragm. You'll inhale again, tuck the bottom under and stretch, exhale, and shorten. This, you're going to go back and forth for about 6 breaths, trying to work on just isolating in that lower back. In doing this, we're going to integrate your core, your hips, your back. It's going to start to get things moving. It will help to isolate that lower pelvis and lumbar mobility and motion. It can be scary when you're first injured. And in the very acute phase, you may not want to try this. But as you move into sub-acute and chronic phases, this is an excellent exercise to start to really isolate our core stability and mechanics with breathing to make sure that we're not holding our breath as we're exercising. I know low back pain is not fun. I've had it myself. And it really hurts when you try to sneeze or cough and you can't get comfortable, or you think you're going to move quick and you go to get up and it just grabs you. I know it's not fun, but remember, pain is temporary. All those small steps that you make in movement will lead to big changes overall. Start off small, start off easy. It doesn't have to debilitate you. Work these exercises in so that you can create that movement and have less pain as you're going. What if today's pain becomes tomorrow's strength? Remember, when you stay consistent and you keep a positive mindset, you can do anything you put your mind to. I hope you found this video helpful and the exercises are helpful for you. I will leave a link for just the exercises below so that you can access them and save them if you like. If your pain persists, please don't hesitate to reach out to your physical therapist. You shouldn't be struggling with pain. Talk to your physician, get a referral if you need it to your physical therapist. And if you need a referral for a physical therapist in your area who recognizes the importance of breathing for core stability and for back pain management, then reach out to me, Laura at MoveBetterLLC.com, and I'm happy to refer you to somebody in your area. If you like this, please give it a thumbs up and share it with somebody else who might need to hear it. And make sure to subscribe for more tips on how to manage pain, improve movement, and to live your best life. Thanks for watching, and I'll see you in the next video.